Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers, presented by Compass case managers like me. In this video, we take a look at managing the high cost of Medicare with CF. You'll find additional videos and more information in this Understanding Medicare series on the Navigating CF playlist. The decision to go on Medicare will likely have major financial implications for people with CF, especially for those who become eligible through the Social Security Disability Insurance, or SSDI, before the age of 65. Medicare does not start until after 24 months of SSDI payments, so you may need to pay for a plan through the marketplace, COBRA, or a family member's employer until then. Add to that Medicare's high out-of-pocket costs and the fact that you cannot use manufacturer copay assistance with Medicare, and the expenses can be overwhelming. Let's take a look at the options for people with CF to assist with Medicare's costs, and keep in mind, if you need help understanding your options, Compass is here. It's important to know that Original Medicare does not have an annual out-of-pocket maximum. For hospitalizations or skilled nursing facility stays, Part A has a high deductible and daily copays based on the number of days in your stay. Part B will pay 80% of the approved costs. As an example, for a doctor's visit, Part B will pay 80% of the approved amount. You are responsible for the remaining 20%, plus anything above the Medicare approved amount. With Original Medicare, a Medicare supplement policy, or Medigap, can help with some of the high out-of-pocket costs associated with Part A and Part B covered services, but it will not help with Part D costs. Medigap plans are sold by private insurance companies, and you'll pay an additional monthly premium, which can be expensive. As you can see here, there are 10 standardized Medigap plans, A through N. Each lettered plan offers the same benefits no matter which insurer you select, so it's important to compare prices. The best time to get a Medigap policy is during Medigap open enrollment. That's the 6-month period when you first sign up for Part B. During this time, you have guaranteed issue rights, which means insurance companies cannot deny you coverage, charge higher premiums, or impose a pre-existing condition waiting period. At other times, you may not have these rights. Keep in mind that federal law does not require companies to sell Medigap plans to people younger than 65 in all states. So, purchasing a Medigap plan may not be an option where you live. And Medigap isn't available to people younger than 65 with end-stage renal disease, or ESRD. You can learn more on Medicare.gov or connect with a Compass case manager to discuss your options and the associated costs. If you choose a Medicare Advantage plan instead of Original Medicare, you still must enroll in Part A and B and pay the monthly Part B premium, in addition to any premium the Advantage plan may charge. Medicare Advantage plans do have an out-of-pocket maximum on Parts A and B, which includes Part B drug costs, but your Part D drugs do not count towards the out-of-pocket maximum. Remember, with a Medicare Advantage plan, you share costs until the maximum is met, but your provider options may be limited to their network. Medicaid is a type of public health insurance. Each state runs its own Medicaid program, which means eligibility requirements and benefits can vary from state to state. If you are eligible for both Medicare and Medicaid, known as dual eligibility, your state Medicaid may cover Medicare costs, such as the Part B coinsurance for covered services and your Part B premium. Those who are dual eligible are automatically enrolled in Medicare Extra Help to lower Part D copays. We'll talk more about that in a moment. It's important to remember that Medicaid is managed by your state. If you go to another state for care, your Medicaid may not cover the out-of-state providers. There are also specially designed managed care plans for those who are dual eligible and have Medicare Advantage. Medicare Extra Help, which we just mentioned, is offered through the Social Security Administration. It helps people with limited income and resources handle the costs related to Medicare Part D prescription drug plans. People who are eligible receive assistance with monthly premiums, annual deductibles, most copays, and coinsurance. There are also 4 Medicare Savings Programs, or MSPs, as you can see here. These are federally funded but state administered programs for people on Medicare who have limited income and resources. These programs are not Medicaid. Instead, they help with Medicare costs such as Part B premiums and, in some cases, deductibles and coinsurance. Your enrollment in an MSP will automatically qualify you for Medicare Extra Help. You should contact your state's Medicaid office or check its website to find out about eligibility requirements. There may be other financial support available through some nonprofit organizations that offer copay assistance, which is different from manufacturer copay programs. A Compass case manager can help you learn more about resources that may be available to you as well as their requirements. Visit support@cff.org/insurance for more information and resources about managing the high cost of Medicare. And remember, Compass case managers are available to help you identify and tap into all of the resources that may be available to you.